key tip for anyone out there who wants to insert anything into their anus, make sure it has a flared base. Do not get, because I hear nightmare stories about something.
You're listening to the In Your Pants podcast. I'm your host, Dr. Susie Gronski, your penis-friendly pelvic health physical therapist, sex counselor, and educator, helping you get in the know down below. In a predominantly female-centric field, finding a pelvic therapy provider who works with men is rare. What's even more rare is finding a male pelvic floor therapy provider. Unfortunately for men, options are limited. Here's a rough estimate according to the Academy for Pelvic Health Physical Therapy. Out of 3,836 members, only 677 indicated that they treat men. That's only 17% of their members. Why is this a problem? There are millions of men desperately seeking pelvic care, and unfortunately there exists a care gap in men's pelvic health, which creates barriers for men when it comes to seeking proper health care for their urological and sexual health concerns. But times are a-changin', my friends. There's a growing number of interest in supporting men in pelvic health. And my guest today, Jake Bartholomy, is one of the leading voices of men supporting men with their most intimate concerns. So join us in our conversation as Jake shares his personal experience and journey in pelvic floor therapy, the common challenges that men face when seeking education and training in pelvic health spaces, and we even managed to sneak in a little anal play, how pelvic therapy can support anal-curious explorers. Jake grew up in Alaska and ran track at Penn State and went to Slippery Rock University for his Doctor of Physical Therapy. He then moved to Seattle and worked in outpatient orthopedics. He took his first pelvic health course in 2008 and has focused mainly on pelvic health since 2015. He enjoys teaching and speaking at conferences, but is very passionate about increasing the diversity of pelvic health therapists. So let's dive into the world of intimate conversations right here on In Your Pants. Jake, thank you so much for being on the show today.
Thank you for having me. It's an honor to be here.
So let's dive right in. As a cis man, can you share your personal experience and journey into pelvic floor therapy?
I can. It's different than many, especially different than the cis female pelvic floor PTs I've come across. I was nudged into it by my coworker who treated all pelvises. We were in a typical outpatient ortho clinic, and she was the one pelvic floor PT. And she had a very, very busy practice. Plus she teaches, and she had a wait list 3 to 4 months long. And when the very first male course by one of the Con Ed companies was written, it happened to be hosted in Seattle. And she said, "Hey, Jake, do you have any interest in treating male pelvic floor?" She's like, "Because if you did, it would get men in right away." She's like, "I could get more other people in sooner onto my schedule." She's like, "I'm right here to mentor you." And of course, being, classic ortho PT, really thought I was going to do sports med and be at a big university coming out of PT school as an athlete in college. And the clinic I was at was next to university. We got a lot of kind of the tough athletes, but also saw general public. And so it really hadn't crossed my mind. But she was very convincing, and she's like, and she gave me the perfect line was, "Just take the course. If you don't like it, you don't have to do it." And I was like, okay, I was open-minded enough, and it was a 2-day course. Then it's now a 3-day course. And I took it, and like everyone who's scared to death to go into a course that's going to have internal rectal labs, multiple, I was freaked out. And then coming out of it going, that's not so bad. I was still really scared to see my first patient, which I know is very, very common with everyone taking their first pelvic floor course. Mm-hmm. It's still like, I don't know if I'm ready to see a patient, but going through the process wasn't nearly as bad as I thought it would. So she nudged me into it and then started mentoring me and gave me some of her existing patients, so I didn't have to eval anyone right away, which was
Right.
helpful.
Mm-hmm.
And then I was quickly like hungry for more. I'm like, okay, what's the next course? And so then I took a colorectal course a few months later. And so that's how I got into it.
Awesome. Awesome. And so from your perspective, so far being in the field as a cisgender male pelvic therapist, what are some of the unique challenges and barriers that cis men face when they're trying to seek out education and training for pelvic therapy?
That is a great question because it's real, or it has been real for me. I'm hoping it's changing now, but I started in 08, 09. And that first course was here in Seattle, which we're a very progressive area. There's a big continuing ed company here. My coworker was one of the lab assistants. Kathy Wallace was one of the lab assistants. And she's
Nice.
a teacher. Yeah,
OG,
she was a,
OG.
I know, as an assistant. Yeah, it was a big deal because it was kind of the first male course. So it was a
Mhm.
big deal. Like she wanted to be a part of it. And and the two instructors were fabulous. And to me, it was my first foray into it. So I had no idea there was one other male in there who flew up from Palm Springs. And so to me, and it was great, no issues. And that was my paradigm. So then I signed up for the next one, which happened to be in Minneapolis. And I've now learned certain parts of the country, especially the Midwest, comfort levels very, very different. And I walked into that room the first morning and I saw, 39 heads turn and look at me with just icy cold stares. Like it was very palpable. I'd never felt that before, like walking into a room. And I was like, what did I just feel? And then I kind of processed it. I'm like, oh, they're not used to a male being in the room. They know this is there's going to be internal rectal labs. And it just really caught everyone off guard. They didn't know I was going to be there. And so I sat in the back and let people choose to sit by me. So I didn't sit down next to someone to force them to be my lab partner. So if someone sat by me, they were choosing to. And luckily, the instructors pretty quick started introductions in the back of the room, and like, "Oh, you're also lucky to have Jake here." Both those instructors taught the male course, and so they're the same ones. They knew me. They're like, "Oh, you're so lucky to have a male in here, and you have a prostate. You guys are going to be fighting to be his lab partner." And that wasn't true. Well, a couple people I think
Sure.
did want to actually work with me, but I found out later there were several that said, "Hey, I want to be on a separate side of the room. I do not want him as a lab partner." And they told the instructors, and they're like, "That's fine. That's fine."
Mhm.
I wish it said, "Please stop the icy cold stares," but
Yeah. Yeah.
but but the fact that I had a few people around me, a little tribe that wanted to work with me and were awesome and open minded and probably already treating men. A
Right.
lot of the people that had been doing it for a while and having success with tough chronic pain end up with men on their schedule, whether they wanted to or were trained in it. They're going to end up with men on their schedule because the urologists don't know where to send them.
Mhm.
Um, so then that was all I took for a little while. I mean, that's all that really pertained to me because I was kind of limiting my practice to pelvises with penises. And but then down the road, I was like, I'd like to be open to seeing the trans community. And so to do that, I kind of need to know all the possibilities that I might see, right, of a pelvis. And so I took the intro pelvic floor one, it's a vagina based course. And having remembered my Minneapolis experience, I emailed everyone in the course ahead of time and said, "Hey, I'm going to be in this course. This is why I'm taking it. I'm mainly focusing my practice on this. This is why I'm taking it. I'm not going to I'm going to get there early and, let people choose to sit by me. I'm not going to, and I just try to get that out there and let people mentally prepare. So I did the same thing. And again, it was really the same thing. I didn't get icy cold stares, but people chose to sit away from me or not work with me. And others chose to be by me. Actually, one woman, it was so sweet. She was scared to death to be there, because this is a lot of them. This is their very first course, right? They hadn't taken anything yet. This is PF1 for them. And she was scared to death. She was really being encouraged by her company to take this course. And she had gotten my email. Like, I turned out that only half the class got my email. Like, for some reason, I don't only had half the class list, so half didn't get my email. So we're surprised that I was in there. She was one who got it, and she used to sit by me because she was worried about how I was going to feel and wanted me to feel comfortable, even though she was scared to death herself. And it brought a tear to my eye when she told me. So there's just awesome people out there. But I worry about, and I'm a pretty strong person, and I've been doing it for a while at that point, luckily. And I was expecting, some challenge or whatever. But I think about the other cis male PTs who want to get into this field, and there are challenges and barriers, and they might be more sensitive to that type of feeling. And then there's also, I think some of the requirements have changed in a few of the big con ed companies, where you can't just take the male course. You have to take a prerequisite course that's vagina based,
That's interesting.
which is a barrier, right? That's increased cost. And then at least one of them, I think you still have to bring your own vagina to the course for a lab partner. I'm not positive on that, but as of not too long ago, that was true. And so you think about a new grad who wants to do this, and they're going to fly to a city, and they have to fly someone else also and pay for them. And then just what message does that send? Like, oh yeah, you can take this course, but you got to do this and this and this. It's just not welcoming when we are desperate for all the peoples to be treating this. We just need more of everyone, especially cis men, but people of color, more trans PTs. We just need everyone to help represent the patient load that we're seeing, right? And give people options. Because here in Seattle, when I stepped away because of my child and school issues for 14 months, just about once a week, someone reached out to me, another PT or a physician, say, hey, Jake, are you seeing patients again? If not, do you have someone? Who do you recommend? Because my patient really would like to see a male if possible. Exactly. And there's one other in the area that I know. Luckily, there's lots of cis females who treat all pelvises, and that's great. But I understand sometimes someone has a preference, and that's fair. And if that means they're going to be more relaxed and they're more likely to access help, then I've had this provider guilt, for the last 14 months of not seeing people. Like, I just feel like this obligation to treat, which is a bummer, because it'd be nice if we got more people into it.
Exactly. And speaking of, so we're kind of going into this conversation about the misconceptions and the stigma surrounding pelvic health and the role of cis men in pelvic floor therapy. So can you help us unpack that? Like, what are some of those stigmas? Where do you think they're coming from? And how can we collectively, as a group of providers and the community, really work to dispel, these myths and stigmas?
Yeah, that's a tough one. And I'm going to have to guess as best I can, because luckily I haven't felt that there's been such a need, because so many men are dying for help, because especially, as it takes them so long to access care when they're having dysfunction, right? For multiple reasons. And I've heard you talk about it on multiple shows. And it's very true. And so by the time they find me, they are very happy, and they're like, do whatever you need to do, kind of thing. But in general, you're right. Like, maybe leading up to that, when they first have symptoms, and someone or a subreddit group says, check out pelvic floor PT, and they Google it, and they get freaked out about an internal exam, and they're like, ooh, I don't want anyone doing that, and especially not a male or whatever. And then, of course, the whole Larry Nassar thing with the gymnastics community just did not help the pelvic floor community at all. And it's such a bummer that we get that rap more in PT, whereas you look at physicians, and like, people tend not to care what urologist they're going to. There's a lot of male gynecologists. There's, and so it's frustrating that we don't have that same level of respect, that we can be just as professional as a physician. So I think that's slowly changing. And I really think it has improved, but it's still there, and still a barrier.
And what about some of the stigma for other healthcare providers? So even that, the misconceptions and stigma around, because we are in general, and you've named this is a very pelvic floor therapy historically has been very female centric, gynocentric. And so in your experience as being a cis male and stepping into these spaces, what do you think, that why did you think you got those really cold icicle stares and really there's this resistance, right? There's a resistance of men in these spaces. Can you talk about that?
Yeah, and again, all I can do is hypothesize that people were thinking of what's in their paradigm, right? Their paradigm, and look at our national association. It was the Academy or the section of women's health forever,
Hmm.
even though it included men's health. It was called, and the journal is still called the Journal of Women's Health, right?
Right.
So there's just these overlying messages constantly out there, subtle and blatant in your face. That it's women's health. It's women's health. It probably started with pre and postpartum, which is fantastic. And then of course it spread into women's pelvic pain, even if they hadn't had a child or pregnancy. And then from there bled into male pelvic pain. Hey, I know you treat women's pelvic pain. Will you see this person? And so it slowly added in men, but they were never embraced. Not early on, they were not embraced or encouraged. There was no research. The research is still really, really,
Hmm.
really poor and lacking, as you know.
Yes.
um, and so I think just a lot of women going into pelvic health because of their own journey. They want to go help other women along that journey. And so a male patient or a male PT coming into their course in a very intimate type setting was just not part of their paradigm. So I think it caught them off guard. I think now that it's becoming more talked about and more exposed, and there's more male speakers at big conferences,
Hmm.
um, it's we're turning that corner. So I haven't been teaching those core courses lately since the pandemic, and so I'm not sure how the feeling is. Well, a lot of the courses now are like hybrid or remote, and so you choose who you want to do your lab partner with, and you zoom in right from somewhere, so you can very specifically choose who's in your room for your lab.
Hmm.
So I hope we didn't take a step back with that.
Right.
Um,
Hmm.
but that's the best I can guess. I mean, do you have your suspicions as well, or what was your experience? I mean, of course, you're so much more open. You limit your practice to treating men, but
Yeah.
early on you didn't, right? Early on you kind of got into women's health, right? Or tell me.
Yeah, yeah, true, because that's what was available, right? So very similar, 2010 is when my career started and I graduated, and really it was because there was no other option offered. I mean, there was nothing that I knew about in my curriculum. It was really women's health, incontinence, mm, postpartum, prepartum, that sort of thing. So it was through men reaching out. They were very brave, to reach out and to say, hey, you list all these conditions for women. I also have some of these, do you think you can help me? And that's where it all started. Is I just was like, this is kind of ridiculous. Like, where are the resources for you guys? Like, you all have the same parts, just organized differently. It's a shame that y'all don't have anyone to go to. Like, who do you go to? And that's really what the problem is for a lot of these guys, is they have no idea where to go, what spaces are safe to lean into without feeling like the situation is going to be misconstrued. Because again, I think it goes back to our profession, or at least this field, is very gyno female centric. So providers, the number of providers available to treat men are most likely going to be a female provider, unless they're again, like I say, unicorn male therapy provider like yourself, which is
Mhm.
growing. To your testament, it is growing as we continue to elevate voices and promote advocacy for this care gap, because there is a significant care gap in the availability of healthcare for men and their pelvic, urological, and sexual wellness health. So, I think modeling is the best way of seeing other, having practitioners see a female provider work with men and how to confidently do
Hmm.
that, how seeing male providers working in urological sexual health spaces for all people, not just men. Again, it's not that, oh, I'm a male therapist, I have to work with men, right? You
Hmm.
could choose to,
Hmm.
certainly, but I think broadening the perspective and having conversations around essentially the sexual ambiguity, because that's what it is. It's sexual ambiguity. It's how do I feel safe? How do I feel safe? And also how does the patient feel safe? I think we're always like, it's me, I'm uncomfortable, I want to be safe, I don't want to, and that's true. And you also have another individual in that conversation that also needs to feel safe and have a space to lean into without judgment or shame or misconstrual. And I think boundary conversations are what is really missing from the curriculum and building in this confidence and communication skills that is lacking from the allied health profession.
Yeah, that's true. And that's a good point about it's still just not talked about like early on about protecting yourself. What if this happens? What if someone's inappropriate? Because it's so rare, but I think that's a big fear that's preventing a lot of people from seeking out the other sex as a for therapy, right?
And it's all genders, it's not here to stereotype or stigmatize one gender over another. It's
Right,
all people with pelvises. There's no discrimination there. At least I can only speak for myself. When I have
right,
a therapeutic relationship agreement form, etc., I give it to everyone. I give it to
right.
everyone. I have had my
Yeah,
share of experiences with all people. So,
right, right.
it's not to be, discriminatory in any way or one-sided. It really is
Right.
just, here's how I operate, and here's how I would like to engage in this therapeutic relationship with you, regardless of what your genitals look like.
Exactly, exactly. Yeah, and then teaching around that, like how to then give the therapist tools to successfully do that, safely do that, and help them feel comfortable. And so I'm actually doing a webinar in a couple of weeks on like evaluating and treating a male patient. I have video and pictures of like how I drape and stuff. And granted, it's coming from a male who's pretty comfortable doing it. I think it'd be great. It'd be something, I don't know if you've done things like that. That might help women say, oh, well, yeah, that was Jake doing it. He's much more comfortable in case, the penis slips out. He's not, freaked out about it or whatever. The patient might not be. But what about a cis female PT doing it and her techniques? And so, hey, maybe you and I could do a joint thing. That would be great. Like, um,
Absolutely. I'm all for it. And I do have a sexual pain course for cis men, and I do a comprehensive genital pelvic exam. So there's that modeling of showing people like, hey, I'm a female provider. I touch the penis, whether it's flaccid
yep.
or erect, it happens. Here's how you do sensory testing. Here's how you do tissue mobility testing. And really just to validate, like, show me where it hurts for that individual. If we're just moving their genitals out of the way and saying like, yeah, sure, let's not ask that question, but also let's just make sure the penis doesn't slip out, like you said, like, oh my goodness.
Mhm.
And how is that experience like for that person on the table who really wants to feel vetted and validated? I mean, part of that therapeutic process is for them to be seen and heard without being shamed and judged. And that's, I think, an important piece. And so you're right. I think having more people model what it's like, and to comfortably and confidently do that, it's
Right.
possible. So that's beautiful. I think it's beautiful.
Yeah. And to talk about all the options that might happen, like erections might happen, but it's in context, whether it's inappropriate or not. Most, 99% of the time, it's a reflex and it's not inappropriate. And the patient's more freaked out than the
Yes,
therapist. And there's good strategies in different positions, sideline and prone, to hide that. And, like, it can happen then and no one even knows. And you can still treat and
exactly.
reach a lot of the things you need to reach. And it'll just make everyone more comfortable.
Exactly. Absolutely. Yourself as a practitioner, and also the person on the table, asking them, what position do you prefer? What would feel safe for you? Right. And
Mhm.
including them in that partnership and collaboration. So it's great. It's amazing to have these conversations. That's one of the reasons why I really wanted to bring you on the show, is to demonstrate and model like this is certainly possible, but also that there is a significant care gap and availability of resources for men, or people, pelvises with penises,
Mhm.
there's millions of individuals who are seeking care, and we really just don't have the people to offer that care. And so the more that we have these conversations, I'm hopeful that the trajectory will still continue to go in a positive direction. So
Yeah, exactly. And that's my goal when I speak now is even more than patient care or specific techniques. I'm encouraging the audience to please, if you don't treat all pelvises, look at yourself. How come? Why not? Ask, be honest with yourself. And some have had trauma or religious reasons, or their spouse says no, and that's legit. But if it's just a little bit of fear of the unknown, then I challenge them to dive into that and unpack it, as you like to say. I love that term. And and can you challenge yourself to maybe do that? And if you do already, do you have a coworker who is not currently in pelvic health? You can encourage and tell them about the benefits and how, like, you will always have a job, you will always be among the best paid, and like you could have, it's the one option really for a solo cash practice, because there's such a need for it. Where if you're a general ortho person 4 years out, you're there, people are going to want to use insurance because there's plenty of those people doing that. But if you're in pelvic health, you can do kind of whatever model you want and name your hours and name your clinic. So there's a lot of perks to it, and just more, the reward at the end of the day of helping the pelvic health patients has been a lot more rewarding than helping my total knee patients, which is great. And I loved my job before, but then I got into pelvic health and I'm like, oh wow, this is really, really rewarding.
yeah, yeah, I agree with you. That's been my same sentiment. So knees and penises, all very rewarding. It's
Yes,
all
yes,
connected. Um,
yeah.
we'll switch. Let's switch gears a little bit about the community and those folks who are seeking pelvic health care. What strategies, from the male perspective, male therapy perspective, have you found to be effective in engaging other pelvises with penises to just get help? To talk about their pelvic health concerns, or to seek an initial evaluation from a pelvic therapist. What have you found to be the most effective?
That's a really tough one because I tend to see them after they've seen several providers, several physicians or naturopaths or acupuncture. They've tried a lot of other things first, and then I see them. And of course, the goal is to get them in sooner. And I don't see them other than, what really helps is spouses, so wives that are getting pelvic floor help, and then they realize if they're at their clinic and they see something about male pelvic health, and they say, hey, my husband has this thing, could you guys help that? And so the women in men's lives have been really instrumental in getting men in sooner than the men would on their own. My big thing is I want to go speak more to primary care physicians and urologists to really consider pelvic floor PT, because, as you know, the first line is antibiotics. With pain and prostatitis, they're just throwing, and if the first round doesn't work, then they do this low dose many month program. And it's not to blame them at all. It's just a lack of knowledge, right? There's a lack of research. It's so hard to research because there's so many different causes of pelvic pain and prostatitis. And so it's so hard to know to try PT. But I want to tell them, hey, it's really a low cost, um, non-invasive, thing to try. And even if it's not addressing the exact cause of their problem, I bet because of that problem and their tension and anxiety, that they've added a lot of tension down there that we can at least help decrease a lot of their symptoms while they're still trying to tease out maybe the ultimate cause. And so educating those providers is really what I want to do, try to get to them so the patients can then try to seek out PT sooner.
Right, that really good strategy. And yes, just community, educating the community, health promotion, right, which is what we're all about as a profession.
Mm-hmm.
Education is the pinnacle of our domain. So that's wonderful, really. So we're gonna segue again, yet again, because this is gonna be a very oddball question that I'm throwing in here for you, Jake. I hope you're ready for it. Let's talk about anal sex and anal play. So These discussions about anal sex, anal play are not typically prominent in pelvic health spaces. I mean, they are in, I have to say, in my space and my practice, definitely, let's talk about everything and anything. But in general, if we're talking about pelvic therapy, we're not talking about sex, sexual practices, preferences, likes. Can you elaborate on like our role as pelvic therapy? Like how do pelvic therapists become more comfortable asking questions around sex, sexuality, and practices, and what the role of pelvic therapy can play for individuals who are exploring anal experiences? So how can we support that?
Great question. And it's not oddball to me. It's not out of left field for me because I just spoke at a very large conference on this topic. And I think I'm kind of curious to know, but I think it's like the first time it's really been talked about at a large conference. Um, and yeah, and so it was very fun and enjoyable. And the audience was like totally into it, and a very, very comfortable audience because like the conference is in a big hotel and a lot of people stay at the hotel. And even one time, like waiting in line for the elevator, a group of ladies started asking me about douching, anal douching,
Uh-huh.
and cleaning out. It's just like only here, only here at this conference would this happen to me. And it's just funny how the level of comfort that we gained, but that's very rare. Like you said, it is not common, and there's a lot of people very afraid to talk about it, even in pelvic floor therapy. There's just a big stigma around it, uh, and we need we need it to start with us to change that dynamic, the narrative, the feeling, the emotion around it. And you're listing off all the things about why it's not talked about, and one is not even pleasure. Like it's not talked about for pleasure.
Right.
People talk about fissures and hemorrhoids and constipation pain and stuff like that, but what about anal intercourse, and what about pain with penetration? And um,
Mm-hmm.
so many people just feel like, oh, maybe it's supposed to hurt, and that's, we got to get around that and educate. And so I think it needs to start with our paperwork, our intake paperwork. That is a great place because there's a lot of people who um, are nervous to talk about it, but they're much more comfortable writing it. And so I think that's a great place to start. But then I recognize there's a lot of therapists in a big organization, they have no control over their paperwork.
Right.
So then they have to get comfortable in their subjective asking about it.
Mm-hmm.
And it's just practice. It's really just practice. And it can be really, and it just so helps to make it matter of fact. Like you ask about, okay, any bowel, bladder issues, peeing, pooping, and how about sex, intercourse, anal or vaginal, and it just make it just matter of fact, flat tone, and you just have your little checklist, and you just make it sound like it's normal. And there's lots of people doing it because there are lots of people doing it.
Yeah. Mm-hmm.
And even that first visit, the patient might be a little bit caught off guard and still not comfortable talking about it, but you planted a seed, and then hopefully maybe later that visit or another visit, and you build trust, and they're like, hey, when you asked about anal intercourse. And so I think us normalizing it and making it matter of fact, routine, will help the patient realize it's not a kink, it's not it's not abnormal, it's not taboo. So it's really, really falls on us. And luckily I even had a physician, she's going to her own like concierge practice from being in a hospital, and she knows what I do. And I told her I'm opening my new practice, and she's like that's something, she's like, I want to get better at talking with my patients about. She's like, do you have a list of questions? And so I'm going to help her come up with her intake paperwork just around this topic. And I love that.
That's wonderful. That's so great. That's perfect. And we step into these roles, right? As educators and modeling what it's like to say, hey, let's normalize these conversations. We really don't need to stigmatize them in any way. In fact, it's an opportunity to support someone who might be really suffering in silence, so to speak, right? Thinking that they're alone or that they're an anomaly or something like that. And whether it's, anal play, anal sex, anal girthing, whatever it is, or even beyond that, it doesn't have to be the anus. We can support them. We're body experts. We can educate, the sex education that we never got, that we never got in
Exactly.
AT school or any school for that matter. So why not?
Exactly. One of the studies I came across for my talk interviewed college men, like cis hetero college men at a Midwest university. But towards the end of the study, or like in their conclusions, they had a great quote that says, as the medical professional, so us, we can normalize men's anal receptivity and help moderate gender norms and the social inequities they uphold. Which I just love that quote, and wanted to get that in there.
Thank you. Oh, I love that. Well, on that
Yeah.
note, oh, I did want to ask you something. Bonus question, bonus question. In our Instagram correspondences, you had mentioned something about dilators. So we're talking about,
Mm,
anal play,
yes.
etc., rectum, anus, anal dilators, quote unquote, rectal dilators. Can you help us unpack the language around that and what those two mean?
Absolutely. And I'm glad you said that because I wanted to touch on that because that's another part of normalizing this, because for so long they've been called vaginal dilators, and pelvic floor PTs have used them because they can work. They're the same. They're great, and they can work well for helping decrease tone or whatever you need to work on rectally. And finally, there's a company, Intimate Rose, has a line of dilators called anal dilators. Um, because even though the vaginal dilators worked great, still just being labeled vaginal dilators, there's that message like, ooh, that's maybe I shouldn't be doing this to my anus. And so there's just that subtle and almost more direct message. Because there's another company out there, I don't want to name them, but that also has very similar dilators. They're fantastic, great, lots of sizes, like 8 different sizes at least, but they're labeled vaginal dilators. And so the fact that now there's a company, Intimate Rose, labeling them anal dilators, that just makes someone realize like, oh, hey, it's okay to do it. That there's a product labeled for that, called that, it must be okay. And I mean, I'd love us to get to the point where we don't need to label them. They're just
Right.
dilators or trainers,
Trainers. Yeah.
and at first I was like trainers, but I was like, I kind of see that. Like someone might not want to think about dilating their anus. Like they just might have the image that it's going to stay open, right? And which it doesn't happen. But I could see why some people might prefer the term trainer or some other term. But regardless, these products are out there and they're fantastic and helpful. And I'm fine for now if they're called anal and vaginal, and if that helps people buy them and realize they're out there and it's another tool to help treat at home. That is really, really fantastic.
Yeah, love it, love it. I did want to ask your opinion about the shape, right? So we were
Mm,
talking about there are various different types of dilators and trainers that some are more cylindrical in shape, like the Intimate Rose dilators that you're describing have more of an hourglass shape. Can you
hmm
speak a little bit to if one would be better than the other to use for and for what issues or conditions or pleasure?
Yeah, that's a great question. And I hadn't actually thought a whole lot about it, but now that you got me thinking about it, I like the hourglass shaped ones because you can find within one particular one, you can pick, larger type one. It starts really, really small. So you have a lot of choices depending how deep you go with that as to the amount you go. And then it could kind of double as a butt plug because it gets really narrow again before the flared base.
Mhm.
And key tip for anyone out there who wants to insert anything into their anus, make sure it has a flared base. Do not get, because I hear nightmare
Yeah.
stories about something like a light bulb
Yeah.
that
Yeah.
can get lost in there. It can break. Like,
Mhm.
please use something with a flared base, or it's super long and kind of has a handle. Because that's the other thing I was going to talk about. So, hourglass shape, great because it gives you lots of choices. You can put it all the way in and it gets back, super narrow for the sphincter can close back down and you can leave in if that's a pleasure to you.
Mhm.
Um, that same company, Intimate Rose, makes like a S-shaped wand that's wider at one end and narrow on the other end. Plus, they make it so it vibrates now. And I think vibration is lovely, both for pleasure, but also therapeutically to help things relax. And it's not hourglass shape, but one end's thicker, one end's thinner. And so it gives you choices, and you can angle it a little bit there more too if you're trying to loosen up a specific area, or with the vibration if you're trying to provide pleasure to the prostate, if it's, pelvis with a prostate. And that's fantastic. So I just love it. To me, the best one is the one you're going to use, like whichever.
Right.
So I say buy both, and see what feels right to you and what you're going to use. That's what matters.
Absolutely. Absolutely. And I do want to also give a shout out to TouchBotTech. TouchBotTech is a up and coming adaptive sexual wellness company, and they are making sex more accessible for all bodies. And so they do have an extension handle that can be adjusted to length, the type of a toy, so it could be a sex toy, or a dilator. And so for people who have different bodies and different preferences, this can be a nice tool to add to the addition to make pleasure or therapy more accessible and also more comfortable. So yeah, check them out, TouchBotTech.com. I'll make sure to link that, and also Intimate Rose, certainly. And yeah, this is great. It's one of the first that I've ever seen of these extension handles for
kudos to them. And I don't know their background or not, but I think that's a huge benefit to OTs getting into the pelvic health world, which is new to me over the last couple of years. I didn't really realize that OTs can dive into that, and that's fantastic. And they have a great perspective on these adaptive equipment and making it more accessible to those physically challenged or neurologically challenged. And so kudos to OTs. And it makes me wonder, like, who started TouchBot, if it was a PT or OT, it doesn't matter, but it's just,
no, it actually
shout out to OTs.
Yeah. So the co-founder, Margaret Anderson, it is a woman disability led company. So
Gotcha.
for sure. Yeah. And shout out to OTs, because they did speak to occupation, they got help from occupational therapists, physical therapists in developing,
help design it.
Excellent. Absolutely. It is a fantastic product. Like I said, I'll link it in the show notes and the YouTube description below, because it's very cool. And I'm so excited. I'm excited for expanding accessibility and sexual wellness for everyone.
Yeah. Wellness and pleasure, right?
That's right. That's right. So Jake, what are your tips, advice for those who are newbies with anal play or anal sex?
That's a great question. And there's a lot of great videos and podcasts out there, some humorous ones too, including, have you heard the podcast Sex with Emily? She is great. And there's one episode on anal sex where she finds 4 of her best friends, and 2 are comedians. And so it's really funny. I disagree a little bit. They mention how, do your Kegels, ladies, to have better sex kind of thing. And so of course we can address that in a whole, it's been addressed lots, but otherwise it's a very fun, entertaining episode. But in other ones, there's a great video YouTube podcast by Taylor Johnson, who's a sex mastery coach for men. And he has done a couple different ones. One, he interviewed a porn star and asked them about how real is porn in general. It's a long interview, but he specifically asked about anal. And the guy's it's not that real, because they edit it so much. They don't show the actors warming up for 5 to 10 minutes ahead of time and gently massaging and using a dilator or trainer or finger or whatever to warm up. And they never show lube application. And 80%, so then Taylor, on a separate podcast, Taylor watched lots and lots of anal sex and took his own data and found that 80% of the clips showed full speed penetration from the very first touch. And that the average length of time from the penis being anywhere near the anus to full penetration was less than 10 seconds.
Wow.
And so So for the newbie out there, just understand that is not real. That is not going to be pleasurable unless you're into pain, and that's fine too. But if you want it to be enjoyable and not uncomfortable, take your time. Lots of lube. Find the right lube for you, and research lubes for ingredients that work for you. And maybe we can do a whole nother podcast on lubes, because I learned a lot in researching for my anal sex talk. What else? So going slow, warming up, warm up by yourself several times probably, or practice by yourself before you're with a partner, and just getting used to touch down there. Learn how you best relax, like just using your own finger in the shower, because our external anal sphincter is under our control, and you can learn to just kind of relax that by thinking about it. But the internal anal sphincter is autonomic, and it relaxes, when you need to have a bowel movement or with stretch and pressure. And so you can gently go in with your finger and just gently press a few seconds each direction, like on the clock, like 3, 6, 9, and 12 o'clock for a few seconds. And that'll help the internal anal sphincter relax pretty well. And do that. And then most people say they have the most success and pleasure with anal sex with a trusted partner. So it's probably not going to be your first time with a new partner. Is probably you're going to be a little more anxious. And so I suggest doing it more with a trusted partner for the first time. Those are the big tips. Of course, we can go into much more detail, but those are the big tips for the newbie.
Well, Jake, where can people connect with you, find you?
Yeah. So on Instagram, it's pelvic floor Jake with underscores between the words. So it's pelvic _floor _Jake. And now I'm just opening a solo practice. And so I have a website in development, but the website will be seattlepelvichealth.com. So all one word. And then my email, if they need, is Dr. Jake, so DRJAKE @seattlepelvichealth.com. And so either Instagram or email is the best way to hit me with questions at the moment.
Awesome. And again, we'll be sure to link all of that in the show notes and YouTube description below. Jake, thank you so much for being on the show. It has been a pleasure talking to you about such an important topic.
It is. And just thank you for all you do for the whole community. It's really, really awesome what you do, both clinically, professionally, podcast, video, courses. You've done a lot for the pelvic health world, and we all appreciate it.
Well, thank you. Thank you so much. And to all of our listeners and viewers out there, as always, in loving wellness for your pelvis, this is Dr. Susie G. Until next time. Thanks for listening to today's episode. Be sure to visit my website, drsusieg.com, for show notes and related resources on today's topic. If you like what you're hearing, head on over to YouTube and subscribe to my channel. On my YouTube channel, you'll find content related to sex, pelvic health, and expert interviews for men. If you got a question or a topic that you'd like me to answer on my channel, be sure to type it in the comment box below.